So Truffle, he went lame on Thursday, the day before Good Friday. I tried to get to my vet, but they'd already closed. But I spoke to an emergency vet, but it got progressively worse. Having spent the weekend having a few screams and on lots of medication, so we saw our local vet, and he had an X-ray and he's got trouble with his spine, so been referred here to Noel. Just rushed down here. He's just uncomfortable and screaming, and I think my son ought to hold him. There you go. Oh, it's horrible. They can't talk, can they? And it's... watching him distress was just horrible.
Sausage. You got your stick. Sausage.
He answers to sausage or truffle.
He's pretty active, pretty vocal, gorgeous.
Very spoiled.
He's very sweet. He was a lockdown baby, so I kind of nagged mum for ages that I really loved Dachshunds and wanted a Dachshund. So one lonely
Eventually
Thursday,
I gave in.
Yeah, he was a very cute little puppy.
So sorry to keep you. Please come in. Good morning. How are you? Nice to see you.
Hi, David. That's me. How you doing?
Please take
This
a
is
seat.
Truffle.
Hello, mate. Truffle, is it?
Truffle.
Hi, mate. Hi. Hi. Are we going to be friends?
Poorly Truffle.
Are we going to be friends? Oh, poorly Truffle. Yeah, well done, buddy. How old is he? Please take a seat.
4.5.
Which leg did he go lame on?
Left, back left.
His back left.
And when you say lame, was he dragging it or what?
He just stuck his leg out,
Right.
literally. And then sort of by mid-afternoon, he was starting to scream and literally scream in pain.
Quite literally.
Oh yeah.
Yeah.
I mean,
Fully
it's
screaming.
horrendous.
So that's unusual. Normally with the most common reason for what you're telling me about is a disc problem, as you know, in this breed. Very unusual for them to scream in pain, though.
Yeah.
This is Anouk, my colleague.
Hello.
How you
Nice to
doing?
meet you.
How does he walk?
With his back legs a bit skewed, a bit.
Can you pop him down?
Yeah, he will walk when he's
all right
on the
now
drugs.
because he's not.
Okay.
He's still under.
So,
Just let him go. So he's very stilted and hunched. So he's grade 2 at the moment. 0 is normal. 2 is ataxic, wobbly like that. 3, he's gone off his legs. 4, he's lost his ability to urinate. 5, he can't feel his back legs. I have no doubt that if we scan him, we will find a disc problem, unless it's something weird, which I tend not to go into with people because I can be here all day listing 100 things it isn't.
yeah.
9 times out of 10, it's a disc problem. And 9 times out of 10, it'll be a disc which is leaking its pulpy center, i.e. this breed are chondrodystrophoid, short legs, long back. Disc extrusion is when the jam donut, which is the disc, leaks the jam squishes the cord. Probably the pain is associated with a radiculopathy, which is where that hits a nerve. And the problem we are going to have is, if we choose to proceed to do MRI scan, we will have to make a decision whether we operate or not. Because clearly, if the disc is continuing to leak out and cause pain, then it's statistically unlikely the medication is going to control it indefinitely, especially if it continues to leak. The other problem is if it does continue to leak, it may squish the spinal cord, which then results in a cutting off of the nerve fibers to the back legs, and then they go to grade 3.
Yeah.
So just pop on the mat here. Just pop them on there for me, please. Come on. All right, big guy, just hold tight, Mom. Hold that head for me, David, please.
Good
Go.
boy. Good boy.
All right, so that's slow. That should come back quicker. That should be, so when I support him, that should come back instantly, which it isn't. And that's the right one, which is presumably the less bad one. Yes, this is also slow. So he's definitely grade 2. He's not yet to the point he's off his legs or has bladder issues. So the decision we have to make is, do you want him scanned? Because there's no point in doing the scan if all we're going to do is the same thing, i.e. just give medicine. Then what's the point? It's just spending your money. I don't want to spend your money unnecessarily.
No.
absolutely the scan will tell you what's the issue. But if we're not going to take action over and above giving him the medicine, then I don't want to waste your money. Grade 2 cases, some of them will be okay with medication and then some of them will not be. Some of them will get worse.
Mm-hmm.
Then I will be recommending immediate surgery under the same anesthetic. The surgery is not rocket science. It's scooping a hole and scooping stuff out. It really isn't rocket science. You just need a steady hand. It's not without risk. Every anesthetic and every surgery has risk. I mean, I've done thousands of these, so I'm not particularly concerned, but equally, I wouldn't be blasé about it. And because you have to be careful, clearly, you can't damage the spinal cord and you can't damage the nerves. If it's deemed that a surgical situation is inevitably going to be the best method of getting the dog out of pain with good function, then that would be my recommendation.
Yeah.
Yeah.
Agreed.
Yeah. Okay. You make friends? Looks like you've made a friend. Give big kisses, please, because we're going to go straight. We're going to go straight to anesthesia. Anouk, you can go down to Nursingville and sort out TPR and carry on, please. Good to see you.
Thank you.
Thank you so much.
Pleasure. Leave it to me.
Thank you very much.
Very
Cheers.
grateful.
Appreciate
Leave
it.
it to me.
I feel quite emotional, but I'm sure he's in good hands, and I feel confident that everything's going to be fine.
Yeah.
Hopefully that it will all be marvellous at the end of it and Truffle will be fixed.
Sorry to drag you back, guys. Come on in. So, do you remember I said to you the screaming is unusual?
Yep.
Normally what happens is they're hunched up and they're painful. They tend not to scream unless you press it, and they get flabby back legs because the nerve impulses don't get through, so they are ataxic, like we've got here, i.e. legs that are wobbly.
Mm-hmm.
Yeah.
The unusual thing was the history of yelping, which we picked up on earlier.
Yeah.
One of the scenarios in which that yelping occurs is if the disc is in the neck and it's not in the area that we typically expect it in Dachshunds.
Okay.
And that is indeed what we have here. And the reason I dragged you back is we are going to have to make a decision about surgery because it's in the neck right here. So this is an MRI scan and this is the spinal cord here.
Yeah.
Okay, so there's pretty much all 4-year-old Daxies that I see have all their discs dried out, all of them.
Mm-hmm.
There generally is not a single normal disc in a Daxi spine at this age. Actually, pretty much from 1 year of age.
Okay.
All of these discs are black and they should have a white pulpy center, but instead they've got black centers.
Mm-hmm.
The disc is dried out, but that's the shape of a normal disc.
Mm-hmm.
Now we're going to move to the next site, and what you're going to see is jam leaking out of a donut. So as we move down towards this site, that's some of the jam.
Mm-hmm.
More of the jam, more of the jam, more jam, more jam, more jam, more jam. Problem you've got is there's a lot of jam.
Mm-hmm.
A lot. And one of the reasons that Truffle is not more wobbly and also not gone off the front legs, which is also possible when this gets really bad because it's in front of the front legs, is that it's spread out. The material's spread out. If all of that was in one clump, probably you would have more effect on the spinal cord, creating probably ataxia on all 4 legs. These legs are further away from that. It takes longer for the signal to get down, hence they're first affected, then these are affected. The decision we collectively have to make is whether to operate or not. Called a ventral slot. So you have to go in here. You can't go in anywhere else because it's underneath the cord. Here. You're going to move the esophagus and the windpipe over to one side, and you got to cut in between the vertebrae, and you make a kind of slot and you suck the jam out. Now, almost invariably, we don't get it all out, but we hope that we get so much out, number one, that no more comes out, and secondly, that we get as much as possible out.
Mm-hmm.
So that should get rid of the pain and any propensity for further ataxia. However, it is a more risky procedure because the patient's on their back, and you can sometimes get abnormal nerve discharges just when you're doing the surgery. You can also get quite a lot of bleeding there because there's 2 ventral venous sinuses here, and once you hit them, you can't stop them bleeding. I know from experience that that will already have impinged the venous sinus there, so I know with almost 100% certainty that as soon as I touch that, it'll well up like a flood of blood. Then I've got a couple of minutes to do my job before I have to bail. Stop, you pack it with collagen, bleeding stops, and you come out. And at that point, you hope that you've got enough out so that no more comes out, and that's so that you've relieved the pressure on the spinal cord. That versus doing nothing. If we do nothing, if no more comes out, then gradually over time, the body may either come to terms with having that there, or macrophages and other cells may eat that stuff up over time, and it may well settle down over time, a long time, like many weeks, months. The problem is generally that it never gets all taken away, and the problem also is more can leak out, in which case you get a dog off all 4 legs. I think you're on the edge of potential quadriplegia, which is where all 4 legs are affected by neurological impairment. Do you want me to proceed?
I don't think we can leave it, can we? So it's this having 4 days of what it's hard, and it's not fair on him.
Sure. Yeah.
And I wish I'd called you on Saturday morning, but
Well, it is what it is.
yeah.
All right. I'm going to get consent form then. What I'm going to do is I'm going to instruct straight away us to carry on now, because I don't see the point in re-anesthetizing tomorrow. All right. Okay, without further ado, I'm going to crack on.
Okay.
Right.
Thank you very much again.
No worries.
See you.
You're welcome.
Hopefully
I'll ring you later.
a few days.
I'll ring you before midnight and hopefully
That's
see you in a few
fine.
days.
Yeah.
You've got like a rock star signature.
Oh.
Like look at
I
that.
am a secret rock star.
Like, look at that. Holy schmoly. Roger Daltrey would pay good money to have a signature like that.
It's got a better phone number as well.
Great.
Yeah, my phone number's brilliant.
Is it? What is it? Did you pay money for that?
No, I didn't actually.
Thank you very much.
See you later. You're welcome.
Give
Bye.
him a kiss from us later.
Will do.
Yeah.
Will do.
I bet, yeah, fingers crossed for a positive phone call later.
Right, we're going to operate on Truffle now. The disc material is leaking out in large volume, and that means that if it were to compress the spinal cord completely, Truffle may go off all 4 legs and be unable to walk. Secondly, if we leave the stuff there, he's going to remain in pain. Joey, thank you so much. You've now become a role holder on top of all your other responsibilities in the practice. I would like some more, please. Role holder. No, could you make that happen again, magically? You got to stay exactly there. Lou, could you take a picture, please? Because I would like to highlight. No. Hold it high and hold it proud. Hannah's leaving us soon. And Hannah has been a fantastic ally to the practice, haven't you, Hannah? Yes. She has been wonderful to work with, except with one notable exception. It has been impossible to impress Hannah. I could have transplanted the head of a giraffe onto a lion, she wouldn't be impressed. I'll show her the most advanced technology in the world. This is what I get. Meh. That's all I got. And therefore, Hannah has kept me intensely humble for 2 long years. And now she has to go on and broaden her horizons elsewhere. Hopefully we'll one day end up being a superlative ecologist looking after ecosystems on planet Earth, right, Hannah? Yeah. Good job. Just cutting down underneath the neck, moving the food pipe and the windpipe to one side, that's the esophagus and the trachea. We're now going to cut into the disc from which the material has leaked. I've just drilled into the base of the disc, and now I'm going to put a little spoon, which is called a curette, in there. And I'm going to gently scrape away material. You've got to be careful here. Sometimes it starts to bleed a lot at this point, and once it starts to bleed, you got a limited period of time before you have to stop. I'm right on top of the spinal cord now, scooping material out. Stick this thing in now, which is like a hockey stick, to scoop more stuff out. So these are even smaller grabbers. And then I'm going to try and grab it with that little forceps and pull it out. It's spread out quite a distance, especially on the left side, so it's definitely tricky. Doesn't impress Hannah, but it's definitely tricky. Right, Hannah? This is tricky because I'm desperately trying to avoid the bleeding while I pluck out as much as I can of the stuff which has leaked out of the spinal disc. Because once I really tug on the venous sinus, which is the oh. It's a very small amount of material, but it's tricky. It's stuck to the sides here. Ideally, I would like to see the spinal cord at the base of this hole. There was a twitch there. I've just touched the cord there, Hannah. Just on the nerve roots now. Might be a few twitches. This is proving quite challenging to get out because the material is kind of stuck to the spinal cord. I'm trying to gently tease it away from the cord. I'm touching the spinal cord right now. I want to make sure that I've done my very best to take as much of this stuff out as possible. So I can just about see the spinal cord now. Alright, that's us done. I've taken out as much as I can of the material that has exploded up against the spinal cord, and now we're going to close. Hopefully Truffle will respond well. We'll know in the next couple of days. Hi Donna, can you hear me?
I can hear you, yes. How's he doing?
Fine. So he's waking up now. I've done the surgery. Surgery went fine. So I'm sure I've not got all of it, because there's only so much you can do down a tiny hole. And I elected to retreat when I felt that I had enough, but I know I won't have all of it. I just pray that I have enough of it so that Truffle is comfortable and happy. The wobbliness and the potential for all four legs to go off, for him to go off all four legs, that's not going to happen.
Thank you.
But the potential for pain for the next couple of weeks, can't be sure about that.
Okay. Thank you very much, and thank you to your nurses.
Yeah, it's a team effort, you know what I mean, and they all sprung into action, and a pleasure, absolute pleasure. You're good people. It's an honor to serve. Have a good night.
Thank you
All right.
very much. We'll speak to you tomorrow.
Yep. Cheers.
Bye-bye.
Bye. Bye. One of the big privileges of my life is service. I will fully admit to have been a workaholic all my life, like my father was, because he was a farmer and he worked 7 days a week. The animals didn't know it was Sunday. And I'm the same. I work 7 days a week, whether you are working in the NHS, whether you are a police officer, whether you are a member of the clergy. Whatever you do, if you live a life in service, it's a life well lived, I think. And it's an honor to serve really good people like Truffle's family. An absolute honor. But the other side of that coin is that you do sacrifice a lot. I think that Generation Z, Gen Z people, they call it locking in on a goal. I will not spend money for 6 months and I'll save for such and such. I will pass this exam. I will run a marathon. I will do this. And you're locking in on that goal. It comes from gaming, I think, where you're locking in on a target. I have locked into saving the lives of animals since I was 8 years old. That is 1 year short of 50 years now. And I don't regret 1 second of that time spent in service, but I do have regrets about times that I could have been there more for my friends or people I cared or loved. Because Truffle turns up after hours. It's now 10 p.m. I've just come out of surgery. I'm not entirely in favour of, oh, I've got work-life balance, so I've got to leave at 6 o'clock at night every night. No. If you want to be great, you're not going to do that. However, don't pay the price as much as I have, because that'll consume your life. And that's a delicate balance. It's somewhere in between a work-life balance and an obsession. I'll let you have the discussion in the comments. But the reality is, what I'm saying to you is, if you want to be great at something, you got to pay the price. And if you want to spend your life in service of what you want to become great at, you're going to pay an even bigger price. Well done, mate. Oh, you're up and about already. Oh my goodness gracious me. Less than 1 hour after surgery. Look at you. Aren't you a strong boy? Oh my goodness. Hi, mate. I'm sure your neck must be sore. Oh, dearie me. Let me put this towel under your neck. Gee, dogs are amazing. There you go. That's it. Dogs are amazing. If this were you or me, we'd be feeling sorry for ourselves for ages. Wanting to lift his head, but feeling a bit sore. You're such a good boy, Truffle. You're such a good boy. Who's a good boy? Truffle's a good boy. Well done, mate. You're such a good boy. Mama says to give you a kiss. All right, mate. So the night team will look after him now, and he can rest his head on there. He's doing great. That's great. That's a great wake up. Good boy. Hey, Mr. Truffle. Hey, Professor Truffle. How you doing, buddy? Hey, mate. Hi, bud. It's lovely to see you lifting your head up like that, isn't it? Oh, yeah. That's lovely, isn't it? Oh, yeah, it is. So he's doing really well. Remarkably so, really, considering what he's been through. There you come. That's it. Good boy. Good boy. Well done. This dog was in a situation where he could have been paralyzed, and now he's walking just as a result of cutting a little hole and scooping stuff out. All right, big fella. Good boy. Well done. Well done. Good boy. Good boy. Well done, buddy. Well done. Oh, raring to go, aren't you? Oh, yeah. Oh, yeah. That's fantastic. He's doing tremendously well. Clearly he's not in pain, and clearly he's walking very well. So that's a wonderful situation. Within 24 hours of surgery, he's able to walk. Sometimes the simplest things are the best, and this is a very simple surgery, but it needs to be done in time before the disc material causes more damage to the spinal cord and the nerves. It's amazing, really, when you think about it, that such a simple procedure can save a life. The main take-home message here is act quickly. And it's a difficult thing for families because there's always the consideration of risk. What are they putting their dog through? And there's always the consideration with the family of finances as well. Can they afford the treatment that you're proposing? Fortunately, in this case, Truffle is insured, so that makes the practical decision making so much easier for the family. And we could act quickly, and that has saved him from going off all 4 legs and maybe even being paralyzed. Now, Truffle's family, so sorry for keeping you waiting. I was busy on the phone.
No No worries.
I was sipping pina coladas in my office in my jacuzzi bubble bath.
You could have invited us in. Nice to see you.
Well, first things first, welcome.
Thank you.
Secondly, I'm surprised to see you today because I didn't expect that he'd recover this quickly. Thirdly, he's doing great. I mean, I do the same thing every time, but I am at the mercy of biology. When we look at his images, it was a fairly frightening night because I had to call you back in because I knew from the history that the pain could suggest a neck problem, but what I didn't know was how big that volume was. It was quite a large volume of material that had leaked out there. And fortunately for you, you were insured.
Having the insurance has given us we've been able to proceed with you and given Truffle a second chance at having an operation which has probably saved him from becoming a paraplegic and not being able to...
Yeah, not being able to move. Yeah. I'll get him for you.
Thank you.
You're welcome. Yeah, who have we got here?
Oh, sausage! Hello! Hello!
You can sit down there.
Hello, baby.
Look at him wagging his tail, he's so happy. He's such a lovely dog. He's been a real sweetheart to look after. Like, everybody really loves him. I saw 6 people line up to say goodbye just now.
Hello.
It was so beautiful that everybody was saying bye-bye.
Oh, very happy to see Truffle again and looking much better and able to move again, which is fantastic.
Got a good new haircut as well.
Yeah.
Which is quite smart.
Complete miracle, he's walking. I mean, when we came in, his back legs had gone, and when we first went into buying Truffle, the first thing I said was, obviously we've got to get insurance because they're notorious for their backs going, so it's enabled us to make an easy decision. Obviously he was very poorly when we brought him in. Knowing he was insured has given us the freedom to explore what could be achieved, and I definitely think having that was, it's saved his life. He's an integral part of the family, so it's not the same without him. He's got more time yet, so it's good.
Exercise my mind.